All right. Good morning, committee. We're going to go ahead and get started so we can wrap up the business today, and then everybody can go home for the weekend. I know, they just got louder. All right, committee, are there any bill introductions this morning? Seeing none, we'll go ahead and move on to the budget report outs. We'll start with Chairman Hoffman with the general government budget, and I believe you're going to start with the Governmental Ethics Commission. Chairman Hoffman.
Yes, thank you, Mr. Chairman. I am not sure what page it's on in our books because I just flipped to 677 and that's not the right page. So
679.
679, okay. Volume 1. So it's 679, I guess. Yep, there it is. Okay. And of course, the analysis starts on 685. All right, the agency submitted a revised estimate of $751,615, including $487,000 for SGF. That's the same amount approved by the 2022 legislature. The revised estimate does include some changes within categories, including a decrease in salaries and wages and commodities, and an increase in contractual services from the 2023 approved amount. Revised estimate still includes 8.5 FTE positions, which is unchanged. The governor concurred with the agency, and the budget committee concurred with the governor.
Committee, any questions in regards to fiscal year 2023? Seeing none, you move on to fiscal year 2024.
Thank you, Mr. Chairman. The agency requested $808,236, including $531,287 from SGF on 2024. It's an increase of $56,621. The request includes an SGF increase of $43,942 above the 23 estimate. The increases are enhancements for $38,898 all SGF to provide salary increases for multiple positions after a salary study was conducted by a compensation study subcommittee of the commission. The agency also requested $8,000 for employer health group insurance, and then just some small increases in like $1,000 in commodities. The governor concurred with the agency for 2024. The budget committee concurred with the governor with the following adjustments. We deleted $38,898 SGF and not to fund the agency's salary increase enhancement request for 2024, pending review by the House Appropriations Committee during global discussion on salary increases. And then we added language that directs the money received by the agency from all civil fines be placed into SGF rather than the agency fee fund for 2024.
Committee, are there any questions in regards to fiscal year 2024? Representative Sutton.
Thank you, Mr. Chair. I just wanted really to kind of commend the subcommittee on that. Sweeping the fees collected to SGF is consistent with what we've done in a number of other areas in law enforcement, where we didn't want, the number of tickets to fund their new, patrol car, or something along those lines, so that we didn't give them an incentive to go out and, I'm sorry?
Impose fees?
Impose fees. Yeah, that's the word. I was looking for, something else was coming to mind, but I didn't want to say it out loud. So to impose
Imagine
fees,
that.
yes. And so I do appreciate the work done by the subcommittee on that one. One question I did have, though, and this actually was on 23, where they're talking about the compensation study subcommittee of the commission. The commission has 8 people. How do you? What's a subcommittee of that?
Yeah, I'm not sure, but that was one of the. I had a discussion with the executive director afterwards, kind of explaining what other information we wanted, and that was part of it. Is what is that? What did that study look like? Who did the study? And what? I just wanted to copy it, more information on it. So hopefully that's forthcoming to give us more information on that study.
Representative Sutton.
Thank you. Nope, that's it. Thank you, Mr. Chair.
Any further discussion in regards to fiscal year 2024? Seeing none, you may move on to fiscal year 2025.
Thank you, Mr. Chairman. The agency requested $813,610, including $530,000 SGF for 2025. This is an increase in all funding source of $5,374 above, again, the 2024 request. This request is a decrease of $333 less below the 24 request. Again, there was the salary enhancements, decreased employer contribution expenditures of some Medicare capers that decreased salaries and wages, and then increase in contractual services of $5,817. The governor concurred with the agency. The budget committee concurred with the governor, except we added those two items that we had added in 2024. And I do want to make sure that everybody understands, former representative said fees. We are not touching the fees. The fees continue to go to SGF. It's just the fines from going forward would not go into the fund. Fines and penalties would go into SGF. Just want to make sure that was understood.
Any discussion on fiscal year 2025? Representative Howe.
Thank you, Mr. Chairman. Do we know how much is collected on an annual basis in terms of civil fines? I wasn't able to find that.
Chairman Hoffman.
So it looks like that over the course of the last several years, it's been anywhere from the lowest of 17,000 to the highest of a little over 42,000.
Representative Howell.
Thank you.
Any further discussion in regards to fiscal year 2025? Seeing none, Chairman Hoffman.
Thank you, Mr. Chairman. I would move the adoption of the 2023, 2024, and 2025 budget for Government Ethics Commission.
All right, committee, you've heard the motion, seconded by Representative Helgerson. All those in favor of the motion say aye. Opposed? Motion passes. Chairman Hoffman.
All right, thank you, Mr. Chairman. Let's go to Office of State Treasurer, which is page 115, I believe. Same volume, yes. Okay, yeah. All right, the agency submits a revised estimate of $28.8 million, all from special revenue funds. In 2023, it's a decrease of $3.8 million, or 11.7% below 23 approved. It's mainly attributed to decrease in unclaimed property claim payments. Agency requested 40 FT positions, which is the same. The governor concurred, and the budget committee concurred.
Any questions in regards to fiscal year 2023? Seeing none, we may move on to fiscal year 2024.
Thank you, Mr. Chairman. The agency requests $35.9 million, all from special revenue funds for 24. That's an increase of 7.1 or 24% above the revised estimate for 23. The increase is mainly due to Star Bond's food sales tax revenue replacement fund starting in fiscal year 2024. Agency requested $7 million, all from special revenue funds for the Star Bond's food sales tax revenue replacement fund. They also, there's 40 FT positions, which was the same as 2023. The governor recommends $44.3 million, all from special revenue funds for 24. It's an increase of $8.4 million above the agency's request. This increase is all for the Star Bonds sales tax replacement fund. The governor recommends expediting the elimination of sales tax rate on food and food ingredients to April 1st of 2023. Therefore, she recommended a higher amount for the increase of from 7 to 15.4 million. We concurred with the governor, except we deleted the $15.4 million from the Starbun Food Sales Tax Replacement Fund and deleted the transfer from the SGF to the fund for 2024 to review it omnibus. These funds are provided to hold Starbun districts harmless from the elimination of the sales tax on food. So the reason we did this is the agency said it was going to cost $7 million, and that's a 2.5. That was, you know, we've gone down 2.5%. The governor said it was going to cost $15.4 million, which is just a little over double, and she eliminated it completely, which is a lot more than 2.5. You know, it's like another 6%, I think, or something like that. So I think these both are guesses in the dark, and so what we decided is we thought that it would be better to wait till after payments are made in this quarter. We'll have a lot better idea what that amount would be that needs to be transferred, and we'll also have a better idea of the sales tax, if it's going to continue on the same path or if something else is going to be done. So with that, stand for questions.
All right, committee, are there any questions in regards to fiscal year 2024? Representative Sutton.
Thank you, Mr. Chair. I just want to call the attention of the committee to the fact that we already discussed a couple of weeks ago, or maybe a week ago, Department of Revenue needing 6 new people because we decreased taxes. Now we have, Star bonds were funded by food sales tax, so we got to replace that money. So now we're looking at another 7, 15, what is it amongst friends? So somewhere between $7 and $15 million to replace the funding that would have come in from the food sales tax. Bear in mind that none of this showed up in the fiscal note when we passed out the reduction in food sales tax. We were all excited about it, and I'm still in favor of it. But now we're seeing the true numbers of what that actually costs the state. And I just think that this is useful information for us to have in our heads whenever we're making decisions like this, because none of this was figured into the fiscal note. Thank you, Mr. Chair.
Chairman Hoffman.
Yeah, I don't remember what all was in the fiscal note, but yes, definitely, it's something that if we're going to make those Star bonds whole, that's what we're going to have to do. And so I think the $7 million is, for the 2.5% decrease, I think the $7 million is too high if the $15 million is correct for the whole amount. So but yeah, you're right. Seems like the fiscal note didn't totally say what it was going to cost us.
Representative Landwehr.
Thank you, Mr. Chairman. Okay, so we reduced the sales tax on food by how much this year?
Chairman Hoffman.
2.5.
Right.
And we put in 3.5, or it was 3.2 in omnibus for Star bonds.
Chairman Hoffman.
No, we cut it all out and to look at it at omnibus.
I'm talking about last year.
Oh, I don't.
Last year's omnibus, we added 3.2 or 3.5 million. I didn't bring all my sheets down this morning, or I'd have that number for you.
Does staff have any information on that?
We adjusted the transfer process, but no money was transferred last year.
Representative Landwehr.
I wish I had my sheets, because I think that's wrong. Okay, thank you.
Representative Helgerson.
Is the discrepancy between your figures and the governor's figures due to an acceleration of the sales tax reduction?
Chairman Hoffman.
Yes, I think that's the difference. It's just that, so sales tax is 6.5. It went down 2.5. In order to make it go down fully to the other 4%, what the governor put in is at 15.4, and what was in the state treasurer's at 7 does not make sense. As far as it's one of them is not the right amount. So It was just, the committee decided that it'd be better for us to wait until after the revenues have come in for the first quarter, and then we'll have a better idea of what those sales tax actually were, so that we could come up then with a number in omnibus to put into this fund to make these whole.
Representative Helgerson.
Okay, so I make sure I understand this. The amount, is there any amount money in there then?
No.
Chairman Hoffman.
Sorry, Mr. Chairman. No, there's no money in there at this point. No
So-
payments have been made back to the Star bonds because it just reduced starting in January.
Representative Helgerson.
Okay. So we're deficit funded that portion because we know there's going to be some, we just don't know how much. Is that right?
Chairman Hoffman.
Yeah, I mean, there'll be some because it started in January, so January, February, March, the first quarter, when most everybody makes their quarterly payment, then there's going to be a reduction, we know, and so it gives time to figure out exactly what that reduction has been before we decide how much we're going to transfer for 2023,
Representative Helgerson.
or 24, I guess.
You know, I don't understand. First, I agree that we don't know what's going to happen in a change in the legislation. I prefer not making the changes in the bill until the legislation's passed. But I was under the impression when the bill passed last year that we knew we were going to have an amount taking out that was part of the fiscal note, at least that I saw, for the sales tax reduction. Now, that estimate, I think, should probably stay in at this point because it's just like caseloads. That's the best estimate we have, and it sounds like, from what you've said, that you've taken it all out.
Chairman Hoffman.
Yeah, we deleted it and moved it to omnibus.
Representative
But
Helgerson.
like
No, go ahead.
like we've done with a lot of issues like this, we're just delaying it until we look at it in omnibus.
Mr. Chair,
Helgerson.
Representative Carlin, I don't know if you see my hand.
No, I don't. And right now, you're out of order. It's still Representative Helgerson.
Oh, all right, thank you, Mr. Chair.
Okay, my point. Yeah, throughout everything. My point is that we have an estimate that we had from last year. Maybe it was not communicated to some individuals, but I remember seeing that and bringing it up as part of the fiscal note. My point is that since that's what's in what was recommended last year, and that we knew that as part of the bill, we should not go back, but we should at least leave the initial money that was in there, rather than pulling it out pending the passage of new legislation.
Chairman Hoffman.
So there was no estimate made in the 2023. There's no money in there. There's no money scheduled for 2023 to be put into that fund that I know of. And so this is for the payment that would be made in 2024, and it's just an estimate. So I'm not sure what you're meaning in 2023, because as far as I can tell, there's no money in the account. And there was no estimate that was brought through last year.
Representative Helgerson.
Okay. Let me accept that and move to a different question. Where are we at on the LAVTR?
Chairman Hoffman.
Go ahead. Sorry.
Where are we at on the LAVTR?
The LAVTR was there was an amendment brought forth, and it was not passed in committee.
In your committee?
Yes.
Okay. Is money in there for aid for property tax reduction to the local counties?
Chairman Hoffman.
I don't believe so, because we didn't add it to the budget.
Representative Helgerson.
Okay. I guess I'm going on just raising the point. Unless you add the proviso in, and unless it's passed, we're obligated by statute to put the money in. The proviso says that we're not going to do it this year, for this fiscal year. And I understand that since I offered it originally many, many years ago. But the governor gets away and the legislature gets away of taking out that money in the budget process by not putting it in initially and then saying, we're going to pass this proviso that does not put the money into the local communities. So I'll be very happy to deal with it later on, but we're not being consistent. We're letting the governor and the legislature skate on not putting the money into the locals because that's what we've done. But we're taking out what I think was a legitimate reduction or a legitimate increase in order to fund the Star Bond Fund. So we'll deal with it and settle up later on, but the governor does this sometimes does it all the time with Medicaid, plays the budget this way or that way. And it's not only this governor, it's all the governors. We're doing it also, the subcommittee and our committee, because we're playing whatever we think is the best way before we've even passed the proviso. I'll shut up and leave it at that.
Representative Ousley.
Mr. Chair, I'm looking up information. Can you pass over me for right now?
Representative Woodard.
Thank you, Mr. Chair. I thought I was having a little bit of deja vu, and I was. I looked back to the budget bill from last year, House Bill 2510, which was the final budget, that's where it included the $3.5 million for Star Bunds transfer. So it wasn't in the bill for the acts of food tax, but it was in the budget bill that we passed ultimately. And I'm getting a nod and affirmation, which makes me feel really good. Thank you, Mr. Chair.
Representative Tarwater.
Thank you, Mr. Chairman. This is regarding the food sales tax reimbursement. We have a bill in Commerce to address that. It's part of the new Star Bond bill, and we're talking about it quite extensively. Most of those bills, all of them actually pay off quite early. So and the inflation that we're having on food, especially right now, will more than make up for the difference in what would be collected. So the question is merely, do we pay them now or do we wait and pay them later? Because if we don't pay them now, we might have to collect for a couple of more months to pay off those. But either way, they're going to get paid off. Not quite. The decision is, do we want to dig into today's budget to pay off the Star Bonds early, or do we wait and let them pay off as they will? And then if one doesn't pay off, then we can make up the difference if we have to at that point. That's kind of the discussion in Commerce right now. Thanks.
And actually, I would contend with the actions of the Budget Committee and waiting and seeing exactly what happens as far as legislation progressing through the legislative process. Representative Carlin. Representative Ousley.
Thank you, Mr. Chair. I'm sorry, I couldn't get my mute off. The 3.5%, wasn't that Representative Landwehr mentioned, was that the 2023 amount for July to January? On Star Bonds.
Okay, so the analyst says that yes, there was a 3.5% put in the budget last year, but no money has been transferred at all. The account is totally empty. Oh, I'm sorry. Yeah, 3.5 million. Yes, sorry. 3 point. But no money has been transferred. That account is empty.
Representative Carlin.
But is it because the payments were made to the Star Bonds accounts and to the Treasurer's office?
Chairman Hoffman.
I don't know why there's no money in there. I think we'd have to ask either Commerce or the Treasurer's office and to find out what has transpired, but I don't know.
Well,
Representative Carlin, do you have a follow-up?
Thank you, Mr. Chair. Yes, I would agree with Representative Tarwater that it has to be paid. I guess if we have to wait for an exact amount, that's one thing. But if there's money due for Star Bonds payments, they should be made at least for 2023. We should have that number. and it should be made. And 3.5% doubled would be about the 7% we're talking about in the governor's bill.
Chairman Hoffman.
Yeah, it's not 3.5%. It's 3.5 million, but
I mean, 3.5 million, 7 million. I apologize.
Chairman Hoffman.
Mr. Chairman.
Yes. Chairman Hoffman.
So the best that I can understand is that someone somewhere made the decision to not pay the 3.5 million this year and to move it to that plus the other estimate to 2024.
I was just handed this by staff. So the budget of the Office of the State Treasurer, according to House Bill 2510, stated, due to the timing of the tax reduction, the 3.5 million was appropriated for fiscal year 2024 rather than fiscal year 2023, pursuant to the process outlined in House Bill 2510.
Thank you, Mr. Chair.
Representative Owsley.
Thank you, Mr. Chair. And on a different note, I'm reading the fiscal note for House Bill 2218, setting up the education savings account. And it reads, the State Treasurer's Office indicates the number of participating students cannot be estimated. It carries on to read, the State Treasurer indicates the state of Arizona has a similar program that currently serves 46.5 thousand students. And for these, Arizona has 24 FTE positions in addition to contracting with the outside vendor for certain account management. I'm just curious if this came up at all in the budget discussions.
Chairman Hoffman.
No, it did not.
Maybe just something to put on our radar.
Any further discussion in regards to fiscal year 2024 for the Office of the State Treasurer? Seeing none, Chairman Hoffman.
Thank you, Mr. Chairman. I would move the budget for 2023 and 2024 for the Office of State Treasurer.
All right, committee, you've heard the motion to approve the budget for the Office of the State Treasurer for 23 and fiscal year 2024. Is there a second? Seconded by Representative Turk. All those in favor say aye.
Aye.
Opposed? Motion passes. All right, Chairman Hoffman, you now move on to the Pooled Money Investment Board.
All right, thank you, Mr. Chairman. The Pool Money Investment Board starts on page 197. And the analysis for 2023 starts on page 200. The agency requested an estimation of $812,795, all from the Pool Money Investment Fee Fund for 2023. It's unchanged from the amount approved by the 2022 Legislature. Agency requests 5 FT positions, which is unchanged from the approval number. Governor concurred. We concurred.
Committee, any questions in regards to fiscal year 2023? Seeing none, you may move on to fiscal year 2024.
Thank you, Mr. Chairman. The agency requests $805,463, all from the Pool Money Investment Portfolio Fee Fund for 2024. That's a decrease of $7,332 below the 2023 revised estimate. It's mainly due to the statutory performance audit occurring every 2 years, and 2024 is not one of the year which the audit is scheduled to occur. The budget request also includes an increase in salaries and wages expenditures of $3,639, which is due to employer costs for group health insurance, and offset by decrease in contractual services due to the biennial statutory audit. Agency has still 5 FTE positions, which is the same. Governor concurred. Budget Committee concurred.
Committee, any questions in regards to the Pooled Money Investment Board? Seeing none, Chairman Hoffman.
Thank you, Mr. Chairman. I would move the adoption of fiscal year 23 and 24 for the Pool Money Investment Board.
Many have heard the motion. Is there a second? Seconded by Representative Helgerson. All those in favor say aye. Opposed? Motion passes. All right. Thank you, Chairman Hoffman. We'll go ahead and turn it over to Chairman Mason with the Social Services budget, and he is going to be giving us the budget briefing for the Kansas Department of Health and Environment Health. Chairman Mason.
Thank you, Mr. Chairman. The budget analysis for KDHE begins on page 1061 of Volume 2. And you'll notice right away some discrepancies between the numbers that I'm going to give you and what's on the budget analysis. And that's because the summary here that I'm going to give you extracted the part for the health. And so the part that is showing in the original analysis and not in the report out is the environment part, which would fall under Chairman Corbett's purview. So I'll begin with that. For fiscal year 2023, the agency submitted a revised estimate of $3.6 billion, including $924.3 million SGF. It's an all funds increase of $38.9 million, or 1%, including an SGF increase of $773,844, or 0.1% above the amount approved by the 2022 legislature. The estimate includes $36.8 million for the administration function, $273.9 million for the Division of Public Health, $3.3 billion for the Division of Healthcare Finance. The all funds increase is primarily attributable to federal funds to provide bonuses to child care workers in fiscal year 2023, partially offset by decreased federal grant expenditures in the Division of Public Health. The SGF increase is largely due to the agency's 4 supplemental requests, totaling $618,595. The revised estimate includes 1,315.7 FTE positions, which reflects an increase of 96.5 FTE positions above the number approved by the 2022 legislature. These include an additional 33 FTE positions in the administration and function, 46.5 FTE positions in the Division of Public Health, and 17 FTE positions in the Division of Healthcare Finance. The agency reports that the additional FTE positions are largely attributable to the continued response to the COVID-19 public health emergency, as well as federally funded workforce development and infrastructure grants. The governor recommended expenditures of $3.9 billion, including $765 million SGF for fiscal year 2023. It's an all funds increase of $265.1 million, or 7.3%, including an SGF decrease of $159.3 million, or 17.2% from the agency's 2023 revised estimate. The all funds increase and SGF decrease are primarily due to the governor adding $265.8 million from all funds, including a reduction of $158.8 million SGF to fully fund the fall 2022 Human Services consensus caseload estimates. The governor's recommendation also includes 1,311.7 FTE positions, which is a decrease of 4 FTE positions below the agency's fiscal year 2023 revised estimate number. The decrease is due to the governor not recommending the agency's supplemental request for legal staffing for the regulation team. That was 2 FTE positions, and local public health also 2. For 2023, the Budget Committee concurred with the governor's recommendations.
All right, thank you, Chairman Mason. So I have a question in regards to the request from the agency in regards to the additional FTEs. They obviously submitted their budget prior to U.S. Congress voting to eliminate the public health emergency in the omnibus bill when that passed Congress. And so we're going to be seeing that phased out in calendar year 2023. So how many positions did they request, and did the governor approve any due to the public health emergency? Because that's going to end in calendar year 2023.
Yeah.
I don't know if there is public health grants. I don't know if they're associated with public health emergency or not.
Okay. Public health grants.
Right.
And then.
They're public health infrastructure grants, largely. But I don't know that they're associated with public health emergency.
And our understanding was that when those federal funds.
Chairman Mason.
Yes, those budgeted positions were largely due to those infrastructure grants, and we did question the agency when they're in front of us about the increase in FTEs. We were told that it was largely due to that federal funding, and as that federal funding dried up, then those FTEs would be eliminated, and right now they're not fully staffed. I'm not sure if that answers your question.
No, in a way, it doesn't, because I'm wondering if the agency is asking for additional FTEs based off of the public health emergency, and that is going to be phased out in calendar year 2023. Why do we need to have additional FTEs? Because when that's phased out at the end of this calendar year, those FTEs will still be in the department. So, in my opinion, there's no need for the additional FTEs. And so I'm wondering, what is the number of the additional FTEs that they're requesting based off of the public health emergency?
Go ahead.
I'm not sure.
Representative Ballard.
I don't know if this will answer your question. All right. So all these people were put on the emergency because of COVID, and it was to control that. But now that they have to come off, they're going to need staff to go through each one of those that were actually put on to see if they qualify now to be on their own without the emergency portion. Try to see if they can put them on another insurance level or something. And then, but it's going to take a while for all these people to go through all of that to try to decide where we do. We just can't kick 150,000 people off. We have to be able to go through and look at what their status would be.
Well, and I understand that, but at the same time, didn't we have the staff prior to COVID-19 to address the issues with Medicaid? I don't see the need to add additional FTEs because, one, the public health emergency is going to be ending because of the action by the U.S. Congress. And I think we could revert back to the amount of FTEs that we had prior to COVID-19.
Well, because...
Representative Ballard.
All right. We're discussing part of why that might be, but it's like, so you have a 12-month window in order to remove these people. Now, the question you asked, did we have enough to begin with? That's a good question. I don't know if we had enough to begin with.
And well, I'm formulating a motion in my mind. Representative Owens.
Thank you, Mr. Chairman. I'm going to continue on the line of thought process from Representative Sutton a little bit earlier. So we needed more FTEs to decrease taxes, and now we need more FTEs to decrease people from the Medicaid rolls. Is that what I'm understanding?
Chairman Mason or Representative Ballard?
150,000.
Yes, during the public health emergency, the amount of Medicaid claimants went from about 400,000 to well over 500,000. So now that is essentially over, then the agency has 12 months to requalify. And we're thinking that there'd be about 125 to 150,000 people coming off of the entitlements.
Representative Owens.
Did we not hire up? Because I would assume that it's going to take more people to get people on the roll. Did we not hire up at that point, add more employees to get those folks on the roll?
That I don't.
That are not still existing to help get them off the roll?
I don't have an answer for that.
Okay.
Representative Landwehr.
I think a couple of things that were kind of confusing here is that if I understand staff correctly, those are federally funded, so I think we need to get clarification on that, number one. But it's actually between, even though we say it's 12 months, it's actually a 14 to 16 months is what it's going to take to bring all of those people off. But we have subcontractors that are contracted with to actually deal with that, because we're still monitoring eligibility. We just don't have as much as we can looking at tax returns and that kind of stuff. We just do not have the participants having to turn in their regular things that they do in a normal course of business prior to the emergency. So I do not understand why we need these FTEs, but apparently they've already hired them.
Well, and I agree with you, Representative Landwehr, and so I'm going to make a motion that in regards to the 96.5 FTE positions, we need to have more information provided by the agency, especially in regards to the public health emergency being dissolved in calendar year 2023, and review that at omnibus. And if there is federal funding that is going to be attributed to this, we need to analyze that as well, because obviously if the federal money dries up and we don't have that federal funding coming through, and we approve these positions, they will retain within the department. So my motion is to review the 96.5 FTEs at omnibus until we have more information from KDHE Health. Seconded by Representative Helgerson. Discussion on the motion. Representative Landwehr.
And just to add to that, so that as we look at it in omnibus, is that out of those positions, 11 are Medicaid. The remainder are for 85 are infrastructure, whatever that is. So, thank you.
Hence the purpose of the motion. Representative Williams.
Thank you, Mr. Chair. So we would look at this in omnibus not before we put our budget together, because we currently have an FT overview that was passed for all of our FTs, whether we're removing them or if we are maintaining them, requesting for those agencies to provide better verification on what they're doing and substantiate the request. So if we passed your motion, it would be after we do everybody else's, or would you rather have it with all the others?
Well, and for the seasoned members of the committee, I mean, obviously we can revisit this when we're having the discussion on the budget bill before we go to the first adjournment in April. My motion is on omnibus, so we can get the clarified information in regards to the positions. If we want to revisit this when we put the budget bill back together in late March, that's perfectly fine with me. I'm just making the motion to be at omnibus. But we can discuss this at any time.
Right, but when we come back, when we are putting the budget together, it would be on that list.
It would, yes.
And so we would potentially, it would be probably behoove the agency to have that prep for that discussion as well as the omnibus.
And I would agree.
Okay, thank you.
Representative Howell.
Yes, thank you, Mr. Chairman. I had a question. I believe the public health emergency in Kansas expired January 20th of this year. Is that correct?
No. It's actually, I might need to have Representative Landwehr confirm this, but the public health emergency was actually declared by the federal government, and that expires at the end of the calendar year 2023. Representative Landwehr?
But there's an extension.
No, I believe, and I'd have to go back because we had this discussion in the CanCare oversight, and I want to say it's like around May 11th. Is where it's at, because they originally thought it would be in January, but there had to be like a 90-day notice to the state, so I think that's how it got moved into May 11th.
All right, thank you. Representative Howell.
Thank you. Yes, it is May 11th for the federal public health emergency, but for the state public health emergency, that's already expired. From what I've seen, that expired on January 20th of this year. Is that your understanding?
Representative Landwehr?
Extended.
You're probably right, because I think that was actually in statute. But this here, the monies that we're talking about here has everything to do with the federal emergency and not the state emergency. They're two separate things.
And one thing I probably need to clarify when we're talking about, when I was mentioning calendar year 2023 with the public health emergency, so it ends in May. It's the enhanced FMAP that is going to be phased out in calendar year 2023. And so there's going to be a decrease in the amount that the federal government has been providing with the 6.2% enhanced FMAP. That is going to be phased out. And so I just wanted to clarify that. Representative Ballard.
No. Most of it was answered, and I was going to mention the FMAP because that will go in stages of percentage as we go down, so that keeps it from all of a sudden. I would really like an omnibus because that gives us a chance to find out exactly when you ask the question about did you need this many and what are those people going to do. It's an interesting dilemma because the way it was explained to us, there's a lot of work to do to take that many people off of the rolls.
Well, and that's the reason for the motion, and so we can have a discussion on that because my perception is prior to COVID-19, these individuals were not on the Medicaid rolls.
Right.
We had the staffing. Now we're being asked to increase staffing because it's going to be reduced. And to me, that does not make logical sense. And so we need to have a review on why we need more FTEs to go back to the numbers prior to COVID-19 and the pandemic. Representative Ballard.
I don't think we have any problem with that because now when you put it that way, I have to ask myself, did they have enough to begin with and what they're going to do with
That's
them?
why we need to have an analysis.
That's fine.
Any discussion further on the motion? Seeing none, I move my motion. All those in favor say aye. Aye. Opposed? Motion passes. All right, we're back on the budget for fiscal year 2023. Any further questions for Chairman Mason? Seeing none, Chairman Mason, you may move on to fiscal year 2024.
Thank you again, Mr. Chairman. For fiscal year 2024, the agency requested $3.5 billion, including $854.8 million SGF. This is an all funds increase of $114.3 million, or 3.2%, including an SGF decrease of $69.5 million, or 7.5% below the 2023 revised estimate. The request includes $36.9 million for the administration function, $209 million for the Division of Public Health, and $3.3 billion for the Division of Healthcare Finance. The all funds decrease is primarily attributable to one-time federally funded expenditures for child care worker bonuses that occurred in fiscal year 23, and those are not included in the fiscal year 2024 budget. Additionally, the agency request reflects decreased federal funding for a variety of grant programs for the Division of Public Health and Environment. The SGF decrease is due to $64.5 million in reappropriated funds in the fiscal year 2023 budget that are not budgeted for in 24. The SGF decreases are partially offset by the agency's enhancement request totaling $5.7 million from all funds, including $5.3 million SGF. The agency request includes 1,317.7 FTE positions, which is an increase of 2 FTE positions above the fiscal year 2022 revised estimate due to the 2 FTE positions included in the agency's enhancement request for the Division of Public Health. The governor recommended expenditures of $4.4 billion, including $748.1 million SGF for fiscal year 2024. This is an all funds increase of $885.8 million, or 25.2%, including an SGF decrease of $106.6 million, or 12.5% from the agency's 2024 request. The governor's recommendation includes the following adjustments. She did not recommend enhancement requests, a decrease of $4 million, all SGF below the agency's 2024 request, by not recommending the following enhancement requests: legal staffing for the regulation team in the Division of Administration, county and regional public health data. She did not recommend the Stan Clark Pregnancy Maintenance Initiative, a statewide psychiatric access program, and local health program. The governor recommended adding $214 million from all funds, including an SGF decrease of $35.2 million to fully fund the fall 2022 Human Services caseload, consensus caseload estimates. The governor recommended adding $671.4 million from all funds, including $21 million SGF to fund Medicaid expansion beginning January 1, 2024. The governor recommended including a decrease of $92.5 million SGF due to savings associated with Medicaid expansion. These savings are attributable to provisions in the federal American Rescue Plan and allowing a 5% increase in the base federal match rate for states that have not yet enacted Medicaid expansion. The enhanced FMAP will be in effect for 8 quarters after expansion takes effect. The governor's recommendation also includes 1,311.7 FTE positions, which is a decrease of 6 FTE positions below the agency's 24 request. The decrease is due to the governor not recommending the agency's enhancement request for legal staffing for the regulation team, which was 2 positions, local public health program, which was also 2 positions, county and regional public health 1 position, statewide psychiatric access program 1 FTE position. Now, in the House committee, we made about 11 changes. We concurred with the governor and made 11 changes. Now, I'll just go through them one by one. We added back in the $338,846 SGF to fund the agency's enhancement request for the Stan Clark Pregnancy Maintenance Initiative. We added $5.1 million all funds, including $2 million SGF to increase complex rehabilitation technology billing codes to 80% of the Medicare rates for 24. We added $10.8 million all funds, including $4.3 million SGF to increase the Medicaid physician fee schedule by 5% for fiscal year 2024. This increase includes 17,254 codes for which physicians currently bill. We added $5 million in all funds, including $2 million SGF to increase emergency medical service ground ambulance rates to 100% of the rural Medicare rates. We added $500,000 SGF to fund Project Access and WIJO Care in fiscal year 2024. Those two coordinate donated health care to provide health care to low-income and uninsured residents of Sedgwick, Wyandotte, and Johnson counties. We added $5 million SGF for primary health projects for community-based primary care grants. This would include your federally qualified health centers. We added $938,756 SGF for the Kansas Tobacco Use Prevention Program for fiscal year 2024. And that amount is the amount that came from the Juul nationwide settlement. That amount is placed in the SGF, so this is just a pass-through where we're designating it for the prevention program. We added $1.7 million all funds, including $687,000 SGF to extend Medicaid adult dental coverage to include dentures and partials. We added $1.4 million SGF to increase funds available to local health departments using the statutory distribution formula. This increase will bring the total amount available to the 100 local health departments in Kansas using the distribution formula to $5.4 million. We also added $20 million SGF to hospitals to compensate for the care of uninsured patients, and we added language directing how that is to be distributed. So now when a patient goes to a hospital emergency room, they're required to take that patient regardless of ability to pay. And therefore, the hospitals have a lot of uncompensated care. This $20 million is just a drop in the bucket, but it's designated to go to the Rural Opportunity Zone hospitals. And then finally, we deleted $671.4 million, including the addition of $71.5 million SGF to remove funding for Medicaid expansion. The all funds deletion includes $703.4 million from federal funds and $39.4 million from special revenue funds. I'll stand for questions.
All right. Thank you, Chairman Mason. I have a few questions. First, in regards to item number 8, wasn't that included for Medicaid adult dental coverage in 2023? I thought we had included that in the budget. I could be wrong, but...
No, not the dentures or the partials.
Oh, not for dentals and partials. Okay. Right. I was just wanting to have clarification. Next, in regards to item number 7, it has that the $938,000, which was the settlement with Jewel Labs. Typically, when you have a settlement, it doesn't go directly into SGF. So, is it money sitting with the Attorney General's office or somewhere else? Chairman Mason.
Mr. Chairman, it's my understanding it did go. It was directed to go to the SGF as part of the settlement. Now, that's my understanding. I can get verification on that.
Okay. I'd like to have clarification because typically when we have a settlement that the state is going to be receiving money, it does not go into SGF, but it's usually held for a particular purpose, and then the money has to be distributed elsewhere. Representative Landwehr.
Thank you, Mr. Chairman. On item number 2, can you explain a little bit of what the complex rehabilitation technology is?
Chairman Mason.
Yes, I can. Those are that's equipment and machinery for people with mobility issues, like the power scooters and so forth.
Okay.
Representative Landwehr.
Now, at one time, and this goes a long ways back, Representative Ballard, we used to have a place where some of this equipment could be donated so that when the next, because especially with children, they outgrow it so quickly, that it could possibly be modified. And that might be something we need to look into and see if that still exists or not. My next question would be on item 5. I'm not familiar with the Why Joe Care. Perhaps you could elaborate. Project Access I am, but I've just not seen this one in our budgets before.
Right. This is the first time they have requested funding. They've operated for a number of years, and they've what they do is they coordinate donated care from healthcare providers. These are doctors, dentists, and so on, and then they basically facilitate that with people who have no ability to pay, and they get that those two put together, the healthcare provider and the patient, and they've been largely operating on donations. And my understanding, I'm going by memory, but for every dollar they raise, they leverage about $16 in free healthcare.
So they're kind of working similar to Project Access and in conjunction with Project Access.
Precisely.
Representative Ballard.
I will just add that since these two programs were founded, we are partners have served 28,000 people. But what they really do, as an example, and our colleges might be willing to treat a cancer patient for free. But if that patient needs surgery, that requires a hospital, an anesthesiologist, nurses, and other staff, and the patient likely will need medications. All of this is provided free. The surgeons provide all of these surgeries and everything else, and they've been coordinated. They have $8 million that's donated. $800,000 is the budget that they really have, and for every dollar, as he said, they get 16 in care. But the big deal was this $500,000 will be split equally between Project Access and WIJO. So it's $250,000 for them to coordinate all of the volunteers. The surgeons and all do not get paid to do this. It's coordinating all of this between the 3 counties.
So I guess my follow-up question for item number 5, well, actually all the items that have been added, but specifically in item number 5 and item number 10, is the intent of the Social Services Budget Committee to have this be an annual allocation?
I don't want to answer that question, but I think I know the answer.
I didn't hear it, I'm sorry.
He just wants to know, is this going to be an annual? We never said it would be an annual.
I can't speak to that. I don't know that it will be an annual request.
They've never been before us before, but.
Well, and that's the reason why I'm posing the question.
All right.
Is because these are new items. And if this is going to be an annual allocation, we need to heavily discuss this. If it's a one-time allocation, that's different. But in fiscal year 2025 and then fiscal year 2026, if KDHE Health is going to be asking for these items to be funded year after year after year, that's where we need to start having a really hard conversation. In regards to number 5, it's never been asked for.
Right.
It's never been included in the budget.
No, it was.
It was? Okay. So I'm just leery about having an increase in regard, especially in number 5 and number 10. And I'm from a rural area, and I am in a rural opportunity zone. But again, if we're going to have an annual allocation in the budget, we need to have a very deep conversation about adding spending if we're going to be talking about this year after year after year. Representative Ballard.
Let me just comment on why the committee felt this was really important. All right, so there coordinated health care for low-income uninsured residents of Sedgwick, Wyandotte, and Johnson counties. Since founded, they have served 28,000 patients, provided $37 million in donated health care, which otherwise we were going to have to pick up, or someone's going to pick up, and $12 million in prescription assistance and durable. This is a county that's using their city dollars, they're using their county dollars, they're going after donated monies and everything else in order to make this possible in these 3 areas. It seems to me if they are willing to do it, if the surgeons are willing to donate this free, if they're willing to take care of all this in their county, then they're just asking for a little assistance in order to help them. But that has saved the state millions of dollars.
Well, I have comments that I'll actually reserve. I won't share those, but I know of other organizations that actually where surgeons and doctors have donated their time. Like I said, I'll just reserve my comments. Representative Williams.
Thank you, Mr. Chair. And so when we're looking at this, it looks like it's over $50 million. And if we pass Medicaid expansion instead of doing the recommendations from the committee, would any of these rate increases incur? So, for example, number 2 and number 3. If we were to pass Medicaid expansion and not pass your increases, which are less than Medicaid expansion, would these occur?
Chairman Mason.
Well, this was my whole approach on this was I talked to the committee and I said, we're all realists. We know that Medicaid expansion is not going to happen. So what can we do to help these vulnerable populations? And we identified these areas. So we're moving forward with the clarity that Medicaid expansion is not going to happen, and these are things that we can do to help these vulnerable populations.
Representative Williams.
But if Medicaid expansion were to occur, these would not be automatically part of that in any way by passing Medicaid expansion. That's what I'm asking.
Chairman Mason.
I can't speak to that. I don't know.
Okay. Well, I have a few more questions.
I'm told no.
Okay. She can answer, but I have a few more questions.
Representative Landwehr.
They would not be automatic because the rates are decided by the state. These rates would still be asked for and they would still happen at some point. You are correct.
Representative Williams.
Okay, so this plan would then help how many existing Kansans and help improve their lives?
Chairman Mason.
Right now.
I'm sorry, which plan are we talking about?
Just not the Medicaid expansion, just the number of Kansans that would be impacted by the improvements that you've listed here. those receiving services?
I don't have a number. I think it's just a drop in the bucket because a lot of these things, like the uncompensated care for hospitals, that $20 million isn't going to begin to touch it. So I don't know. I don't have a.
I can rephrase CanCare. How many individuals are receiving CanCare, or they're receiving medical assistance from Kansas?
Chairman Mason.
How many are in the CanCare rolls right now? I think over 500,000. And that's going to drop down to around 400,000.
Okay. And then the last question is about the Ross counties of $20 million.
Okay. I beg your pardon. I'm sorry.
The last question is about number 10, the $20 million for the Ross counties. Do you have any idea or estimate how that might compare to what they may receive if Medicaid expansion did pass in Kansas?
I do not.
Chairman Mason.
I don't.
Okay, thank you.
Representative Buchanan.
Thank you, Mr. Chair. And that's, I was actually going to bring that up. That's approximately what we had looked at a few years ago. I think we were thinking 19. If you're looking strictly rural, Ross counties does not equal rural. Well, I can't say it today. So critical access hospitals would have the cumulative amount a few years ago was about 19 million. So I appreciate the effort of putting 20 million towards that. Just keep in mind, this is out of SGF when it could be federal funds if we would expand Medicaid.
Representative Ballard, did you have a question or comment?
No, I'm fine. Thank you.
Representative Landwehr.
Thank you, Mr. Chairman. Going back to number 5, Project Access, many times it comes in actually being funded in the governor's budget, and this is a program that's been out there for a lot of years. The YJO Care is, apparently this is the first time that they've come and asked for funding on that, so I'm not as familiar as I am with Project Access, but we have funded Project Access for several years. My question is on number 8, when you're doing the dentures and the partials, is there a limit on how many times that they can get dentures and partials? Because one of the things that we also heard in CanCare oversight is the fact that they lose and misplace these dentures and partials on a regular basis.
Chairman Mason or Representative Ballard?
Yes, there is. It's like a 2-year.
Every 2 years?
Every 2 years.
All right, next question.
Representative Landwehr.
And then on the number 10, I believe that we have, within our current budget, a uninsured reimbursement for our hospitals. Now, I don't know if that's on dish payments or what it is now. So I would ask that, I guess at this time here, I would make the motion to remove number 10 to discuss it omnibus, and in between that, let's get and look at what all line items that we have out there available today for uncompensated care on these patients.
All right, committee, you've heard the motion. Is there a second? Seconded by Representative Helgerson. Discussion on the motion, Representative Owens.
Thank you, Mr. Chairman. I do completely understand the desire to dig into this a little bit more. Now, we recognize that $20 million is not going to represent all of the uncompensated emergency room visits for these 95 counties in the Rural Opportunity Zone. But we hear regularly the same old argument, one of many same old arguments, as it relates to expanding Medicaid, that our rural hospitals are going to be closed if we don't expand Medicaid. So part of my thought in my conversation as I, kind of had this idea with Les Mason and a number of other members was just this idea that here is something that we can do when $21 million was already budgeted out of SGF to expand Medicaid, is let's reallocate that money directly towards one of what they say is the core issue that is driving, our rural hospitals to struggle. And so from my perspective, this is something that I think we could really make a difference. It won't make them whole, but it'll definitely be a step in the right direction. Thank you.
Representative Landwehr.
If you look at states that have expanded, that have Medicaid expansions, they still close rural hospitals. It's not going to save them. It's not enough. What they get on Medicaid expansion is not enough when you start looking at their budget deficits. So they're still going to be coming in and asking for uncompensated care. What I'm asking for here is we remove this item at this time. I could ask to totally delete it, and that's not what I'm doing, is that we remove it at this time and we learn in detail what we are paying for uncompensated care for our hospitals, because there is money out there for that. So that's all I'm asking for it.
Representative Owens.
So I'm taking a partial step.
I do understand and completely agree that rural hospitals are still going to struggle and still going to close, regardless of whether Medicaid is expanded or not. My thought here is simply, this is the one area where our hospitals are forced to provide care, right? It's the federal government. Somebody walks into their ER, they have to be seen. Now, we should really spend a lot of time advocating for our FQHCs and all of these other organizations that can avoid that. However, we still force their hand. So I have no problem looking at it, definitely digging into it in deeper, but I am certainly a strong advocate for providing what resources we can to that cause.
And I agree with Representative Owens. Even if Medicaid expansion were to pass, it does not save a rural hospital. In most cases, it's inevitable if they would happen to close. Medicaid expansion is not going to save them because eventually it probably would close as the years go on. The only thing that I would say in regards to item number 10, and I do like the motion to have this reviewed at omnibus because I would like to change the language. I'm not going to make a substitute motion, but I do agree with the motion made by Representative Landwehr, and I would rather invite the conversation to just change the language from hospitals in general to critical access hospitals, because mainly in the rural areas of the state, that is the type of hospital definition that we have. So if this motion passes, we'll obviously have a discussion later on, but I would like to focus mainly on the critical access hospitals in our rural counties. Representative Ballard.
Thank you, Mr. Chairman. I hate to answer my question there, because I think when we looked at it, 95 counties out of 105 have been identified as a rural opportunity. That's a lot of counties. But I just want to know, how do we find out and measure uncompensated care?
That's a good question, and I don't know if Representative Landwehr has information regarding that. As many of you know, I was in favor of the rural opportunity zones when it first passed in 2012, 2013. However, as time has progressed, we've been adding county after county after county, and now we're at 95 out of 105 counties in the state, and I think it's lost its purpose. Again, if this motion passes, that's a discussion that we can have later on, but I'll now turn it over to Representative Landwehr as she can maybe answer the question you had in regards to what is defined as uncompensated care.
Thank you, Mr. Chairman.
Representative Landwehr.
The hospitals can break that out and tell you what it is, because it's a discussion we've had for many, many years. The other thing that's going to make a difference, and we need to include in this discussion, is the new federal designation of rural hospitals. And that's something that this legislature and our hospitals have fought for years. And finally, the feds designated it. It allows our facilities that don't have, quote, enough beds to meet a hospital designation to actually meet that with a lower number of beds. So that's going to start making a difference in all of this as well. So that new designation needs to be a part of this discussion when we get back to it at omnibus.
Do you add that to your original motion?
Yes, I did. You just didn't read my mind correctly, Mr. Chairman.
And is that fine with the second? Okay. Representative Helgerson.
We're on the motion.
We're on the motion.
Yeah. Last several years, we've had changes in this committee. We have gone from, let's just say, a fairly strict guidelines about how we're spending money to subcommittees, in particular the Health and Service Subcommittee, to add more money for health care, whoever was lobbying at the time. Now, I had many arguments with Representative Landwehr and several other, and the former chairman and Representative Ballard, and this is not a way to put a health care plan together in a health care system. You may not like Medicaid, but what we have done with the Medicaid system, accepted, this is a whole system, and it gives us more money in order to pay for it. Last year, and I don't remember, the last couple of years, we've added like $100 million each year. Not just one time, but base budget increases to our social service budget. We joke at times, not really joke, but we go, let's look at X agency, and they put in 2 positions, and let's take out the position. Our budget's increasing here astronomically, and we're now going to lose a good part of that federal funding. You know, I'm as compassionate as anyone here, but you're piecemealing a health care plan or a health care approach to the whole state. Now, it was many years ago, Lieutenant Governor, and I can't remember the Lieutenant Governor's name with Graves, who was a doctor. He had a radical idea, and he said, we should put a health care plan together for this whole state. Who? Walker? Jack Walker. You know, and I thought, you know, that's not a bad idea. But what we see now is the lobbyists, who is the most effective, having the most success, and I don't know if that's the priority we should use with our dollars. Now, let me make one other point of clarification. Yeah, we are in a motion. Sorry about that. The number 5 and the $500,000. Subcommittee last year didn't put the money in. No, the governor didn't either. I did. I made the motion here in this committee. And I am strongly in favor of it, but I also raised the question that that's not the way you should put a health care plan together. It was put together last year one time because I felt that that was a good project for Sedgwick County, and I forget, you know, I know it was in Kansas City. It makes good sense. But then we should talk with the question, is this, as the chairman said, is this a plan that we're going to now put into our healthcare system with or without the feds? And is it going to be a permanent increase? You know, I'm not going to make a substitute motion to include that number 5, but I may do it after this when we get done. I don't think the $20 million works well by itself. It may work better if the subcommittee comes back and says, this is our health care plan without Medicaid and without the extra $60 or $70 million. But it doesn't work putting a health care plan together in the long term, piecemealing as to who's lobbying with us and trying to deal with it in the short term. So that's why I seconded it. That's why I'm supportive of pulling it out. And then I may go back and start looking at some other things later to do the same thing, and that is to review them as part of a total plan in omnibus.
And I was just going to rephrase the motion is to actually review this at omnibus. It's not completely pulled out, up for review.
Well,
any further discussion on the motion? Representative Ballard.
Thank you, Mr. Chair. I'm glad you add that, not if at omnibus. You know, when we say we're piecemealing it, I would agree that we are, because everybody needs funds. We're being lobbied, yes, by the paid lobbyists, but the majority of people that come before social services are private citizens. And they're coming on behalf of their communities, and they, prior to this, have no input in what we do in the budget. You know, we do our budget this way, but there's a whole bunch of people out there that really have no input. So we'll use an example. We had over 30 yesterday. And part of they talk about what their needs are and everything else. Social services budget, as my partner to my left knows, that these are people that come to tell us what their particular needs are. So when we look at that in terms of what they're doing around the state that we don't always know, we try to include them in the funding process. Maybe that's not as important to some people, but it is to our committee because we are that committee that they can come and say what their concerns are, how much money they've raised in their communities to help this, and everything else. And I think we're just doing the best job we can to help those people that do not have access to additional funding. So I will just say that in terms of that's how important I think social services is out there, the same as Can Care with all the people we hear from. That's their personal time that they can come and tell us what they need. So in addition to the lobbyists, to the experts, the agencies, we're also hearing from the constituents that are voting for all of us to be here. Thank you, Mr. Chairman.
Any further discussion on the Landwehr motion? Seeing none, Representative Landwehr.
Mr. Chairman, I close.
All right, committee, you've heard the motion. All those in favor say aye.
Aye.
Opposed? Motion passes. We're back on the budget for fiscal year 2024. Representative Hoffman.
Thank you, Mr. Chairman. Looking at number 11, I think that there might be some language in the last part of that that is not necessarily needed. I think, as the chairman had said, there is not an anticipation that we're going to pass Medicaid expansion in the 2023 legislature. So I would move that we strike the last sentence where it starts in addition, add language to lapse the SGF funding if Medicaid expansion is passed during 2023 legislative session.
All right, committee, you've heard the motion, seconded by Representative Mason. Discussion on the motion. Representative Landwehr.
Mr. Chairman, the one question I actually had on 11 and just didn't get to is if you delete that, do we also have to delete, because you had, the governor's budget had Medicaid expansion, then it had Medicaid expansion SGF savings. Do those both have to go hand in hand and both have to be deleted at the same time? I don't know.
That would be a question for staff.
I don't understand what this means.
I don't know. It needs to be taken out. It doesn't make sense because it says lapses. So
It means it's just not there.
next year.
So we can't.
11 has the deletion of the funds. This is just removing the last sentence because, like as the maker of the motion said, there's no anticipation that Medicaid expansion would probably progress during the legislative session in fiscal year 2023.
But on that, wouldn't it make sense?
Representative Ballard.
Wouldn't it make sense that if you deleted the 641 million, then that would take care of it because then you wouldn't have any savings because you didn't proceed with what you were doing. It seemed like it would take care of itself.
Well, you're deleting the amount.
Yeah.
In number 11. This is just saying it's like a preemptive sentence that's saying if Medicaid expansion would pass or does not pass, then the money is then allocated in this fashion. The deletion is still there. It's just deleting the last section, the last sentence saying if Medicaid expansion were or were not to pass. Representative Landwehr.
Staff, they have actually done it right. Staff has included those numbers as a total. So my question is moot.
Representative Buchanan.
That's what I thought. That's what I was arguing.
So I guess I'll trust staff with that. There are programs across the board, though, that benefit from Medicaid expansion that would see savings. So my thinking was that we would have to delete the savings, but I will too. All right, thank you, Mr. Chair.
You and I are on the same page.
Representative Helgerson.
Can staff explain or someone explain what's in and what's out then? I'm not sure what's in and what's out. Both.
That'd be a question for staff.
So the savings that's included in here is only the savings that would come if Medicaid is expanded. It's that FMAP, that 5% FMAP that the state would get for 8 quarters. That's what's in here. No other
Savings.
savings. So if Medicaid's not expanded,
Make
we would
it
get
to them live.
That's probably better.
Megan.
So the American Rescue Plan included a 5% increase to the base FMAP if for states that expand Medicaid that haven't already expanded. So should Kansas expand Medicaid, the base cost is the $21 million SGF. And then on top of that, because of the FMAP savings that would come into play for those 8 quarters, that would be about $90 million for FY24. So the savings that are included in number 11 are limited just to that FMAP increase.
All right, thank you. Representative Buchanan.
So I understand what she's saying now, if it's just regarding FMAP, but just keep in mind, there are other savings. There are other programs that would achieve a savings, and that's not figured in. So thank you. Thank you, Mr. Chair.
Any further discussion on the motion? Representative Helgerson.
If I may ask staff, so the 70 million that we've talked about that is savings, is that in or out of the budget? It's out. So we actually are increasing the budget, SGF expenditure $70 million in order to fund this budget with this number 11.
I believe so, yes.
Okay.
Any further discussion on the motion? Seeing none, Representative Hoffman.
Thank you, Mr. Chairman. I close.
All right, committee, you've heard the motion. All those in favor say aye.
Aye.
Opposed?
No.
The ayes appear to have it. The ayes do have it. We're back on the budget for fiscal year 2024. Representative Buchanan.
Thank you, Mr. Chairman. My question a long time ago was on the statewide psychiatric access program. And I noticed that the governor took that out, and there were I just wondered what the discussion was in the committee, and there were some things put back in that one wasn't. Is there some other program that's in its place? Or I might also add that was a recommendation from the Mental Health Modernization and Reform Committee. So I value their recommendations, so just kind of wondering where that's at.
Chairman Mason.
I don't remember any discussion about that in committee. And let me check with staff.
No, it didn't really come up it didn't really come up in committee.
It did not come up in committee.
Representative Buchanan.
There was no discussion of the governor removing it?
It did not come up in committee.
Representative Buchanan.
I don't know what else to say. Thank you, Mr. Chair.
Representative Landwehr.
Mr. Chairman, maybe something that this committee might want to look at as we, not today, but as we advance forward on this budget, it may be time to look at increasing the duties of the CanCare Oversight Committee to where they would have more budget discussions during the interim, which might go back to what Representative Helgerson was kind of leading at, is how do we look at our health care more as a whole, and then that'd be information for the budget committee then to deal with as they come in. Not for us to say this is what you do, but we would have more time to look at some of these things more in depth. Is all I'm saying. So that might be something, is look at maybe adding some extra days to the CanCare Oversight Committee at some point.
And I'm fine with that. We can have a discussion on that later. I guess my initial question to that would be, when they're meeting during the interim, is there not any budgetary discussions going on with CanCare Oversight?
No, there is some, but we really don't go into the weeds on it so much as we do more about policy and also addressing concerns of individuals and organizations that come to us with problems. One thing, if the committee members haven't looked at it, there's an awesome spreadsheet that we use so that, every time we meet, we can't lose track of what was the concerns from the previous meetings or even from a year ago that we're still tracking and that we're still monitoring. But we're more onto the policy side and some of the details of the programs. We do make recommendations on some of these things. I'm just thinking it might be, time for it to go into a little bit more depth now that we've got it kind of in a calming stage rather than a controversial stage.
Well, and I agree with you. Because if you look at the state budget as a whole, first thing that we spend the most on is education. The next is Medicaid. And so I think it would be just plausible for us to have a in-depth conversation with the CanCare Oversight Committee in regards to the budget for the state of Kansas. So I agree with you. We can work on language on how many more days we would like to have extended for that Oversight Committee to meet. But I do think that is something that they should be focusing on as well. Representative Ballard.
So clarification for Representative Concanon. When we talk about the psychiatric access, a lot of that came in with Osawatomie, Larned, community mental health centers, and all of that. So I'm not sure specifically what you were referring to that, because that fits for us more with CanCare. I mean, with Osawatomie, Larned, IDD, the disabilities. So I wasn't sure when you asked that question, what you were referring to.
Representative Concanon.
So on page 1077, there's an explanation of the program, statewide psychiatric access program. And I honestly don't know and I was going to ask Representative Landwehr, because she served on that health modernization and reform. Did you chair that?
Representative Landwehr.
No, I was on the mental. I was on the mental health. You're talking about on the IDD. That was Representative Carpenter.
No. This is Kansas Mental Health Modernization and Reform.
Yes, where are you looking at?
Page 1077, statewide psychiatric access program.
Okay.
I don't know what that is, but you guys recommended it, and I'm interested in it, and I think it's important to have access throughout the state. I know that we had a program where we did a student loan program for students going into psychiatry into the rural area. That hasn't had enough time yet to have any impact, but I'm really interested in this. It was cut, and I guess I'm wondering, I'll rebound Representative Ballard's question back to you, because I don't know what this is. I understand what mental health is throughout the state and the kinds of conversations that you had, but I just would like to know about this program.
Representative Landwehr.
I think, Representative Concanon, we'd probably have to bring that report in. This year, I don't know that the committee recommended so much the SGF as probably the federal side of this, so we could look at it, and I've slept since 2021, so I'll have to go back and look at that report.
Representative Ballard, do you have any additional comments?
Fine. That's fine. I just wanted to, when you said that, I looked at it and I thought, I wanted to be able to find out what that issue was. And I wasn't sleeping, you were. Okay, but thank you very much.
Any further discussion in regards to fiscal year 2024 for KDHE Health? Seeing none, Chairman Mason.
Thank you, Mr. Chairman. And I do have one last amendment I would like to propose.
We killed that other one, so that should come.
Well, this was a promise I made in committee to facilitate and move along. Megan, can we hand that out?
If we had taken this.
So I'm not going to read this whole thing, but I will give you kind of a summary. Basically, this just says that KDHE would provide anyone who is receiving a COVID-19 vaccine or medicine to treat COVID-19 from a local health department for the following. They would provide the following information in writing. Number one, the ingredients of the vaccine or medication. Number two, the known risk or side effects of the vaccine or medication. And number three, the most recent information from the Federal Vaccine Adverse Event Reporting System. And this would apply to fiscal years 23, 24, and 25. We started to have a lengthy discussion, and I just asked if we could defer that until the full appropriations because we were just in the interest of time. So that was my promise to the member, and that I'm fulfilling my promise.
So just to clarify on your motion, it just does say what was printed out and handed to us that it would be added in 24 and 25, but you are including fiscal year 2023.
Yes, it applies to fiscal year 23, 24, and 25.
Okay, I just wanted to clarify that. Is there a second on the motion? Seconded by Representative Turk. Discussion on the motion. Representative Williams.
So this would not apply to a doctor's office or a pharmacy that might provide the vaccine.
Chairman Mason.
Local health departments.
And for other vaccines, what are the requirements?
Chairman Mason.
Where are we seeing that? Where are we seeing that, Representative?
No, it's a question. So I'm just wondering if I take my kids to the physician and they're getting their school vaccines, what's required for them to provide me? I actually don't recall. So I'm just trying to make a parallel.
Chairman Mason.
Are you asking respective to COVID-19 vaccine or any vaccine?
I'm asking whenever you go and get any type of medical assistance or you're taking drugs, there's usually like a list of things that are included. When you get a vaccine, not COVID vaccine, but just regular vaccine, are they required to give ingredients? Are they required to give any of these items?
I don't have an answer for that, but this regards specifically the COVID-19 vaccine and related medications.
Okay.
And I was going to say that because on the line that says any person receiving any vaccine or other medication for COVID-19 from a local public health department, I think it, and maybe Jill can correct me, but I think that explicitly says it's just for the COVID-19 vaccine, not for a flu vaccine or any other type of vaccine that's out there. It's just specifically stated for COVID-19.
That is all it addresses.
Yes, and I absolutely understand that. But my question was really trying to compare it to any other vaccine. I think it would be important. I mean, we get FDA all kinds of notices on food products of what's included in the ingredients when you buy a cupcake, and it's required. I just find it interesting that this wouldn't be required for all vaccines. I'm not suggesting any changes to this amendment. I just find it interesting that you can have something placed into your body and they don't provide this type of information for all vaccines. So that was why I was asking the question, just to be sure, since we have warnings for stepping on a ladder that you might die. So I just thought, again, I like this. I just wish we had this for every vaccine.
Representative Landwehr.
I think what happens, Mr. Chairman, is that some of our, whether you're getting a vaccine in a pharmacy, because that happens a lot with your flu shot, with your pneumonia shot, your shingle shot or COVID shot, is whether it's a pharmacy or it's your physician, that they may or may not, they have this information available and they may or may not hand it to you. It's more convenient when you see it done with your medications when you pick it up. You know, we feel like sometimes we're getting a book. And for some of us, like myself, I'd prefer not to read that because I don't want to know what the side effects are. I just know that I need this med and hope I don't get the side effects.
Even the commercials on TV when they mention the side effects.
Well, yeah, and you know that stuff has a tendency to scare you. So I think this information is already available out there, and it can be done. Many times I think it's just more of a human error of it not being handed to the patient. So,
Representative Helgerson.
You said this was in response to some questions that a subcommittee member had or a member of the committee. Did you have hearings on this?
Chairman Mason.
No.
Was there,
Helgerson.
did you request to hospitals, doctors, health departments, if this would be any additional problem?
Chairman Mason.
No.
Representative Ballard.
Since this was brought up to us, I did check with the health department. The health department does have this information, and they do make it available.
Representative Helgerson.
You said the health departments now provide it, and this proviso is no problem upon request, but this says you have to provide it, right?
Chairman Mason.
Correct.
Representative Helgerson.
Nah, forget it.
Representative Kincannon.
Thank you, Mr. Chair. You know, I can understand 1 and 2 being available, but number 3, the VAERS reporting system, that's public information that anybody can go online and see that, but that's just the public reporting, something that may have happened after a shot, after a vaccine shot, that it may or may not have been the cause of that. So I really would disagree with providing that, and I guess I'd make that a motion to remove number 3 on that list.
All right, committee, you've heard a substitute motion on removing item number 3. Is there a second? Seconded by Representative Helgerson. Discussion on the substitute motion. Representative Estes.
I'm a little hesitant on that one because I think we live in an age where there's so much out there we don't even always know that something exists, and therefore we have it to go look for. So I'm probably inclined to not support your motion, but I appreciate what you had to say about it.
Representative Kincannon.
Yeah, and I get that. I think that this is maybe somebody can give them information that they can go to that line, but I can't imagine a health department handing out information that's not scientifically proven. There's no proof that side effect was caused by the vaccine, and it gives it a level of trustworthiness that it maybe doesn't deserve. But if they could maybe direct them to to go look at the VAERS website, but I can't. It just does not feel right that they would give that out as correct information when it's only reporting.
Representative Estes.
And maybe directing them there is a fair compromise. And in my mind, the difference is many other vaccines have had so much more time to be developed and gone through more processes that this is a little bit different.
Representative Woodard.
Thank you, Mr. Chair. I was pulling up the CDC fact sheets that are given out to patients when they receive any vaccine, and it has the reference to the VAERS reporting on the CDC sheet that they're given. Thank you, Mr. Chair.
Representative Tarwater.
Thank you, Mr. Chairman. Representative Estes made my statement for me. Thanks.
Representative Howell.
Thank you, Mr. Chairman. It's my understanding, and correct me if I'm wrong, but I believe because this vaccine was authorized under emergency use, they have to disclose the risks and things to all people that are getting these vaccines. So I'm not sure this amendment would be necessary because I think that's already supposed to be happening as part of the emergency use.
It is happening.
Well, I'll just speak for my own personal experience. Last week, I had my second booster. I received no information. Representative Corbett.
Representative Mason, when you heard this in committee, was there any downside to this if it did pass? I mean, what negative impact would this have? I mean, it seems positive. What would it hurt? I'm just seeing what the downside might be.
Representative Corbett, that's more of a question on the initial motion. We're on the substitute motion.
Thank you.
On the Concanon substitute motion. So let's keep it directed towards that right now about removing item number 3 on the amendment. Any further discussion on the substitute motion? Seeing none, Representative Concanon, you may close.
I close.
All right, committee, you've heard the substitute motion. All those in favor say aye.
Aye.
Opposed?
No.
No.
The noes appear to have it. Noes do have it. The substitute motion fails. We're back on the original motion. Representative Corbett.
Thank you, Chairman. Representative Mason.
Yes.
To do what?
Change number 3 into the compromise. Let them know that it exists.
State the question.
Yes, please.
So,
Representative Corbett.
in committee, Representative, was there any downside to going through with this? It doesn't seem like it's a negative of anything, but what would it hurt to pass this?
We didn't hear it.
Chairman Mason.
Absolutely. I can't think of any downside if as members are saying this is already done, then it's kind of a moot point. So I don't see the downside in putting this language in.
Representative Landwehr.
Thank you, Mr. Chairman. And I think that being this wasn't able to be discussed and vetted out in committee, we also don't know what the fiscal note would be on this. And it appears that there would be some requirements from KDHE's perspective in tracking certain things to make sure they provide it to the health departments. So we'd also have to know what the fiscal note would be on it.
Any further discussion on the amendment? Seeing none, Chairman Mason, you may close.
Thank you, Mr. Chairman. And from my own experience, I think when we all lined up at the encampment down at the Armory to get our shots a couple years ago, we weren't thinking about information and none was provided. So it's just informed consent. So I would renew my motion to amend.
All right, committee, you've heard the motion. All those in favor say aye.
Aye.
Opposed?
No.
The ayes appear to have it. The ayes do have it. Motion passes. Any further discussion on the budget for KDHE Health for fiscal year 2024? Seeing none, Chairman Mason.
Thank you, Mr. Chairman. I appreciate the lively discussion. I'm going to need my soapboxes back at the end of this, so I'm owed a deposit. So I would move the adoption of the Kansas Department KDHE Health for fiscal year 23 and 24 as amended.
There for a while, I thought you may have another amendment.
No.
Seconded by Representative Ballard. All those in favor of the motion say aye.
Aye.
Opposed? No. The ayes appear to have it. The ayes do have it. Motion passes. The budget for KDHE Health is passed in Appropriations Committee. All right, committee, we do not have any other items for today's business, and so we will be reconvening at 9 o'clock on Monday morning. So until then, we are adjourned.